Good afternoon, everyone, and welcome to our thought leadership presentation about medical dental integration. My name is Amy Nelson, and I'm the Director of Strategic Business Communications at DentaQuest, and will be the facilitator for this afternoon's presentation. DentaQuest and Missouri Care are very excited to host this important conversation with you. We believe that medical dental integration is critical to our mutual goal of delivering high-quality, efficient healthcare. We thank you for joining us this afternoon. Before I introduce the speakers, I have a few brief housekeeping notes. To minimize audio feedback, please mute all phone lines during the presentation. You may do so by pressing *6. As time permits, we will take questions at the end of the session. You may pose your question by referring to the box at the bottom of your webinar screen. Please feel free to type your questions in there. The speakers will try to address as many of your questions as time permits at the end of the session. Also, after the session is over, you may reach out to me directly at amy.nelson@dentaquest.com, and I will be happy to serve as the liaison between you and our speakers. At this time, I'm very pleased to introduce our panel of speakers. Our first speaker will be Steve Pollock, who is the Chief Operating Officer of DentaQuest. Steve Pollock has been with DentaQuest since 1999. He was named Chief Operating Officer in 2011 with oversight responsibility for all business segments. Before this, Steve served in several roles, including Executive Vice President, Vice President of Market Development, and General Counsel. Steve has led DentaQuest's growth in the evolving healthcare marketplace by developing strong customer relationships and utilizing innovative technology and implementing efficient processes. As a leader in the insurance community, Steve believes in developing unique solutions to meet the challenges of the changing market in order to manage patient populations, reduce utilization rates, and control costs for DentaQuest health plan partners. Steve holds a law degree from the University of Wisconsin and is also a CPA. Our second speaker will be Dr. John Luther. As DentaQuest's Chief Dental Officer, Dr. Luther's work embodies DentaQuest's mission of improving the oral health of all. His focus is on outcomes, quality improvement, cost containment, and dental care networks that are willing and able to provide high-quality care that is accessible. Dr. Luther is leading the way through medical dental integration, education, oral health literacy, patient risk management, and disease prevention. He began his career as a private practice dentist in California and previously served as the Chief Dental Officer for United Healthcare. Our third speaker will be Dr. Justin Kramer. Dr. Kramer is the Chief Medical Officer of Missouri Care, a WellCare company. Dr. Kramer joined Missouri Care as an Aetna health plan in 2012 and served as its interim CEO in 2013 and 14. Prior to that, he was Regional Medical Director for Optum Health, a division of United Health Group. Dr. Kramer received his undergraduate and medical degrees from the University of Missouri, Kansas City, and completed residency in family medicine at Mayo Graduate School of Medicine. He also has a Master's of Business Administration degree with an emphasis in healthcare policy from George Washington University. He was awarded the degree of Fellow from the American Academy of Family Physicians in 2008. I am now pleased to turn this over to Mr. Pollock, who's going to lead us on an overall discussion on medical dental integration trends. Steve?
Thanks, Amy. First off, I want to thank everybody for taking time out of their schedule to join us. I also want to thank Dr. Luther and Dr. Kramer for assisting this discussion. I'm going to focus specifically on dental benefits as it relates to integration. And I know Dr. Luther and Dr. Kramer are going to talk more about care. So I'm on the next slide for First, a quick overview of DentaQuest. DentaQuest serves 23.1 million members across the country. One of our biggest customers are health plans. We work with over 100 different health plans across the country, and we provide Medicaid, CHIP, Marketplace, Medicare Advantage, group, individual, dual eligibles, all lines of offerings in terms of dental benefit management. When you talk about who our clients are, it's a who's list. Many of you are on the phone today, and suffice it to say that we work with national health plans, regional health plans that are very focused on specific segments and offer all lines. So I think it puts us in a unique position to share some insights and general themes that we see in the health plan space as it relates to medical dental benefit integration. So we are obviously in the biggest change in our lifetimes when it comes to healthcare. And that change is being driven by a couple of different big drivers. One is, of course, the Affordable Care Act, the Medicaid expansion, the essential benefits, the advent of marketplaces are really changing the landscapes that we work in. The explosive growth of managed care. You all know that more than half of all healthcare transactions will be paid for by government-sponsored programs. Health plans are the #1 partner for government agencies to improve outcomes and lower cost. I think as you look at the requirements around benefits in the medical space, they're becoming very streamlined without a lot of differentiation. I think dental is one of those areas that a health plan can differentiate their offerings through ancillary benefits. And then finally, margin compression. So every health plan is dealing with increased loss ratios as required by ACA and increased taxes and the technology investments and different costs that come with competing in today's marketplace. So every health plan is looking at their members, the products that they're offering, the segments of the market that they participate in, saying how do we grow our business, how do we remain viable. And I guess I'm here to say that I think ancillary benefits are a unique opportunity that is in front of health plans, specifically to grow revenue, to retain members, and to improve outcomes and the bottom line through the triple aim. So I'm going to talk about each of those areas. So what's ahead for ancillaries, specifically dental? And predicting the future is very hard, but what we can do is we can look back at other industries and see how they handle change. And one of the industries that has gone through significant amount of change is the airline industry. If you go back to 2001, when 9/11 happened, certainly there was a significant reduction in the amount of air travel for a short period of time, but there was also a significant increase in the amount of regulations. That combined with the move online and eventually the economic downturn really put pressure on airline companies. And the people who emerged as winners were the companies that were able to think about their offerings differently. So AirTran, JetBlue, some of the smaller carriers started to say, we're going to put our airline tickets online at a low price, and when we capture the member, we're going to add on what the airline industry refers to as ancillary income. You and I talk about paying for extra bags, paying for extra legroom, paying for internet services, but companies like AirTran drove 80% of their top line and bottom line growth by adding ancillary income. So when you compare that to healthcare, lots of interesting similarities. ACA has increased regulation significantly. Healthcare, like the airline industry, is moving online. And I think there are health plans that say, how do we offer a low-cost medical benefit? And then when we capture that member, what are the other types of services or ancillary lines that we can offer to the member? And certainly dental is one of the largest and best opportunities for health plans. The next slide is a little bit of an eye chart. I think capturing a member is one thing. The second part of it is, well, what are you selling them and where are you pricing it? So when I wake up in the morning and my kids have waffles, I have maybe a health bar. Later in the day, somebody has oatmeal. But the point is that there is a specific product that is targeted to each segment of the population and a specific price point. So some people are going to look at a dental benefit and say, well, if it's only $10, maybe it isn't as high quality. Others will say, that, yeah, that's right where I need to be. So I think as you think about offering ancillaries, it's a good opportunity to grow revenue, and your pricing strategy, your segmentation, your marketing, and how you position it becomes really important as you think about your business differently. As I have talked to health plan executives over the last 10 years, I've said, well, how come you don't offer dental? And the number one reason that I've gotten is that too much of a hassle. Nobody wants to jeopardize their underlying medical business, with a dental product. If it's going to be successful, it has to go extremely smoothly. So it's very important for health plans to, as they get into ancillary lines, to really think about, what is that front-end purchasing experience and enrollment. How do you set the member up? How do you service the member? Because while I think ancillary benefits are an important opportunity, there's no question that the underlying medical benefits are driving the consumer's decision, and it's very important that as you offer ancillary benefits that you do it well. I think the other component of retention when it comes to dental benefits has to do with churn. So there was a study done by Kaiser last year on Covered California, which is the marketplace program in California, and it said that 20% of everybody on Covered California would end up in private insurance by the end of the year, and another 20% would end up in Medicaid. So we in healthcare, I think, historically look at Medicaid programs or employer programs or now marketplace programs, but I think the truth is more that we have members that one day are going to be in a Medicaid program, the next day they could be on the marketplace, and then with private insurance. So thinking about a member who is going to travel through different products becomes very important for health plans. You can imagine that if you've worked hard to win members in a commercial setting or a Medicaid setting, and as those members move into different offerings, if you're not assuring continuity of coverage for ancillaries from a pricing and product design standpoint, you could lose that member to your competitors. The flip side would be that your competitors can gain membership as members churn between different programs. So it's very important to think about member retention both in terms of making sure there's an outstanding customer service experience, but also in terms of making sure there's continuity of coverage as members' status changes. All of that comes down to systems. We at DentaQuest have invested heavily in our systems over the last 10 years and are able to offer benefits whether the person's in Medicaid on the marketplace or in a group or individual setting. I think the short of it is that for a health plan to be successful, I think one part of it is certainly product design and where are you playing, but then how do you make sure that there's continuity of coverage. And then finally, I'm going to just finish on analytics and the triple aim. To make sure you have the appropriately priced ancillary benefits to make sure that you're improving population health, to make sure that you're driving cost effectiveness. That all kind of comes down to information, right? And so how you use information is incredibly important. You have to know what happened, why did it happen, but even more importantly, what will happen, and how do you make real-time decisions. Certainly dental sets up for the triple aim. We know that if you get kids in to see the dentist at an earlier age, you're going to have a better outcome at a lower cost. There's tons of data that shows that. The question is, where does each specific member and what decisions and what actions can we take to make sure that they get on the right track. And then I'll finish with slide 12. This is a scatter chart that shows, how you can use analytics to think about who's providing care to members. In the upper right-hand corner, those are, dentists that are doing high-quality work at a low cost. On the lower half of the chart, it's dentists that are maximizing revenue, some doing good care, some not. To me, this is the hope for the future, because every dentist is incented right now to maximize revenue by doing more services. Yet, in fact, when you look at this chart, you can see that that's not happening. So to the extent that we can use analytics and information to drive better outcomes, to make sure the right care is done for the right member at the right time, we can get a better outcome. And again, what that means for a health plan is a lower price point, better population health, a more satisfied member, and a more cost-effective model. John?
Thanks, Steve. I think it's safe to say that the future involves coordinated medical and dental care with an emphasis on what we all know as patient-centered integrated care. And those words sound good, but in order to achieve any of this, we're going to have to break through some of our traditional silos, think outside the box, in order to give this right care to members when and where they need it. So to follow up on what Steve said, how can we start to apply best practices to oral disease? And those two main diseases that we're looking at include caries and periodontal disease. And also, we're not just out to reduce costs, but really to achieve the triple aim. And for those of you who aren't familiar, what that means is that new value proposition that we have to attain is to improve quality of care, reduce cost, and improve the member experience all at the same time. So more and more we're hearing about this link between periodontal or gum disease and other chronic infections. And you see some of those on this slide here. And more we're realizing that even if we can't prove a causal relationship, there is a link. For example, we know that untreated periodontal disease leads to difficulty in controlling such things as diabetes. And if you have diabetes, the likelihood of having periodontal disease is much greater. So could you go to the next slide, please? So in addition to hearing clinically that there is an association between gum disease and other chronic diseases, there have been a number of studies done recently that show that if we treat dental disease, if members are adherent to such things as maintaining their periodontal care, that the costs on the medical side go down. And they go down significantly for a number of chronic diseases. So all of the studies here essentially show those things. So even if we can't prove causal relationships now, we know there's an association, because if we treat on the dental side, we know that overall medical costs go down, and those costs are significant. Next slide, please. If we know that to be true, what would we like to do in our industry? We would like to, as Steve said, align incentives. So we would like to start paying for performance. We would like to start incenting dentists to do things that affect cost and quality. So that's exactly what we do. One of the programs we have involves incenting dentists for increasing the number of periodontal maintenance that they perform, increasing the number of sealants that they place, all in an effort to improve quality and reduce cost on the patient side. Next slide. So going back to just some basics in dentistry, as we grew up, typically we went to the dentist, and the dentist took x-rays and said, you have X number of cavities, and they were filled. Then maybe a year later, you would go back to the dentist and have some more cavities, and they were filled. So when you think about this, what happened is they treated not the disease process itself, but really the outcome or the devastating impact of that disease. What we're trying to do now is understand disease processes better so we can treat the cause of the disease before this disease we call caries result in cavities or irreversible damage to the teeth. We have a fairly good understanding now of what causes cavities. For example, we know that bacteria produce acids, and those demineralize the teeth. If that goes on long enough, it creates cavitation or holes in the teeth that have to be filled. We also know that if we catch the disease early, that we can reverse it without filling teeth. So the more focus that we place on prevention and early intervention, the better the outcomes and the lower the cost of treatment. Next slide. So here we have a radiograph or an x-ray, which is what we're used to historically. So if you look at this picture, again, for non-dentists, you'll see little hatch marks between the teeth. And those little hatch marks represent cavities, the darker little checks that you see between the teeth. And those larger white areas on the teeth represent some kind of filling or restoration on the teeth. Those x-rays or radiographs were typically what dentists use to determine whether or not teeth would be filled. And when they saw those little divots or hatch marks, they would go in and immediately restore those teeth. So again, what we know today is going in and fixing the damage is kind of like fixing the roof on a burning building. If you don't understand and address the underlying cause of the disease, you never really solve the problem, and we're caught in a vicious cost and quality cycle. Next slide. So we now have some tools where we can identify caries or cavities without using x-rays. So this is an example of using a laser to see the difference in contrast on the tooth on the left, the upper left, where you can see a cavity in that tooth where you couldn't see that with the naked eye. If you look at the picture on the lower left, you'll see examples of a white spot. So today, we may opt, in some cases, to remineralize those teeth using, for example, high fluoride paste, instead of just going in and filling those teeth automatically. And on the lower right side, you see what we know of as a traditional cavity, that dark spot or hole in the tooth, which would have to be restored with some sort of restoration. Next slide. So we'll talk a little bit about innovation today. And again, when we grew up, we might have had disclosing tablets used on us, and those were little red tablets. You chewed them, spit them into the sink, and when you smiled into the mirror, you would see that your teeth had certain red spots on them, which showed where you were brushing or not brushing. So today we have these tastes that can show different types of plaque. So they can show by color whether the plaque is new and easily cleaned away. They can see if the plaque is old, which allows bacteria to gain more of a foothold in the plaque and cause more damage. And they can also see that plaque that is acid producing and very detrimental to the teeth. So today we have disclosing tablets that can show a variety of things to the dentist and the patient. And they can show the amount of damage that, that may be caused by the type of plaque on the teeth. Next slide. So when we think about disruptive innovation, again, I mentioned the laser, but this is very interesting because in the lower left there you see a picture of a computer with the image of the tooth, and that tooth has red light, and that red light shows where a cavity might be starting. So again, when we were growing up, or even recently, you would go to the dentist, and that dentist would use an explorer or a sharp little pick, and he would look around your mouth and poke at your teeth. And if the pick stuck in the tooth, that would indicate that you had a cavity. Unfortunately, just the act of putting the pick in the tooth can create holes, which then have to be filled. And again, as I said, today we don't really encourage the use of an explorer like that because some of those initial cavities can be remineralized with high fluoride paste, such as the one shown on the bottom of the slide. In addition, what this laser can do, it not only shows you evidence of a cavity, it shows you the depth of that cavity over time. So if you look at those pictures on the upper right, the dentist, if he's using one of these high fluoride pastes, can track whether or not that tooth is remineralizing over time. So the point of all this is to show that with innovation, we can do new things to drive prevention and early intervention, and again, break the cycle of disease. And that's what we're trying to accomplish with some of these things. Next slide. So this slide just shows what we want to see with prevention. So it's a very simple slide, but what we're hoping to do is increase the money we spend on preventive strategies. And at the same time, we want to see that those strategies pay off. And what do I mean by pay off? We want to see the more expensive restorative cases going down or decreasing. So as we increase prevention, improving the quality of care, we want to see a decrease in expensive and sometimes painful restorative procedures. So again, this slide, if it proves out, would show increased quality and hopefully decreased cost. Next slide. So again, to wrap up, the great thing about dental care is that the two main diseases, which are periodontal disease and caries, the disease that causes cavities, are almost 100% preventable. So if we work to align incentives and achieve those goals, we can push the cost curve down and improve the quality of care. So we want to move towards primary and secondary prevention and align incentives in our plans to do that. And I will now turn it over. Dr.
Thanks very much. I appreciate it. And this is Dr. Kramer, and thank you, Mr. Pollack and Dr. Luther. I am going to talk a little bit about the relationship that we've had with DentaQuest, which has been a very long-standing, successful, collaborative relationship, and we've been fortunate to be able to build on our shared goal of improving preventative care, both oral and physical, and recognizing the interrelationship between the two. And we're going to discuss in my section some data, both academic and some real-life data with our plan and DentaQuest that demonstrates the significant impact that managing dental care in an environment where it is considered, along with the physical health of the member, is significantly advantageous to a health plan. So we're going to talk about a little bit about what we've done in the past with DentaQuest, the initiatives that we are starting and doing now, and then a bit about the future of our relationship with DentaQuest and what those benefits will mean for our members. And we can go to the next slide if you want. So I'm going to talk about a program that we've had a great deal of success with that started in around 2011. And just by way of background, there were a couple of reports, but a 2012 Pew Hospital ER report, healthcare cost and utilization report that came out around the same time, that showed a significant increase in emergency room visits for dental-related issues of about 16% nationwide from 2006 to 2009. And we have absolutely seen real-life utilization data consistent with this as well at our health plan. But long before these studies were completed, Missouri Care and DentaQuest realized that Medicaid members are visiting the emergency room for dental issues, and they were really only receiving antibiotics or pain meds, and not actual preventive dental care or restorative dental care. We know that the DR doctor can provide sort of solutions to alleviate the symptoms, like an infection or pain. They can't definitively treat the dental issue. Is somebody not on mute? If you could please place your phones on mute, that would be greatly appreciated. Okay. So managing dental emergency rooms in a hospital emergency room, obviously not cost effective, and can be very draining on already short resources. We talked about the margin compression that we're all facing in healthcare. And in response to this trend, we partnered with DentaQuest to implement the Rerouting Emergency Dental Care program. As I mentioned, we kicked off this program in 2011 with the goals to educate members on the importance of proper preventative care from a dental perspective, decrease emergency dental care, and increase dental care in a dental office setting. And we really started that by establishing a baseline of members who utilized the emergency room for dental issues. We supplied medical claims data for ER visits identified as non-traumatic dental codes, using an established list of ICD-9 and HCPCS codes to ensure that we filtered the most appropriate ones. DentaQuest then worked directly with the members who visited an emergency room for a non-traumatic dental issue, and by doing that, we have been able to successfully reduce repeated visits to the emergency room. What DentaQuest has done with those members when we provide the information, the data to them, is a twofold member education. One with direct member education and outreach by phone calls. And members who use the emergency room for dental services would receive a follow-up phone call to assist in providing, or to provide assistance in finding a dentist, or making an appointment, or education about what to do in an emergency dental situation. The call center staff there at DentaQuest would then recommend dental follow-up visits, or provide dental referrals, or set up dental appointments if the member was willing. And they also followed up with this educational component with mailings, and they did an ER program mailing that emphasizes the importance of preventive dental treatment and offered ways to access dental care in an emergency situation. And then a secondary postcard to members they were unable to reach by phone during the direct member outreach. The results of this, you can go to the next slide, the results of this were quite impressive. Prior to implementing the ER program, DentaQuest established a baseline of the number of Missouri Care members who use the emergency room for non-traumatic dental care. The baseline was established using 12 months of medical claims data, filtering for the non-traumatic dental codes. And then quarterly reports on the ER program use comparison to baseline were created as part of the measurement. Post-implementation, we pulled this quarterly data and analyzed it to determine decreases in emergency room utilization for non-traumatic dental care, increases in the number of members seeing dentists for post-emergency room care, and increases in the utilization for dental preventive services. And when you look at the slide, again, I think it speaks for itself. We saw, and there's several selected quarters here, we saw in some cases significant declines in the utilization of the emergency room for dental visits. And emergency room visits, as you probably are all aware, are very expensive. And an average ER cost of about $630 plus or minus